It's been a fantastically rich discussion that we've had today. So what I'm going to do is just give you what I've heard, and sorry, I won't have picked absolutely everything up, about why collaboration for community engagement is important, especially for vaccine trials, who we think we need to be collaborating with, how we collaborate, and then what I've pulled out is what I think are the top tips for collaborating. So on the back of a fantastic, I think, presentation from Jessica, you know, what do we mean firstly by engagement? So it's a number of different processes and different elements. And of course, there are a number of different partners as well, and there are different objectives to engagement. But why community important is incredibly important for vaccine trials is to build trust, confidence. It is an ethical imperative. Specifically for vaccines, it's critical that we're able to actively recruit participants, and that participants are willing to take part. And then also to maintain compliance with vaccine schedules. So I think that maybe sets it apart from other types of trials. I think it's important, given COVID at the moment that we're in, and the number of different vaccines that we're likely to see coming out for COVID, is in ensuring that we work with the networks that we already have. Given that we'll have COVID vaccines quickly, there won't be as much of a lead-in time to engage with communities. So where have we already got those relationships in place? And I think that's very much what CEPI has been about. It's building those relationships across those different stakeholders early, so that when we have the situation we're seeing now, and also what we saw in Ebola, is that we can rapidly respond. I think somebody else raised the point about the importance of community engagement and the feedback we get from it to ensure that donors understand the importance of community engagement in trials, recognising that, of course, for different trials and research will have different types of donors, and of course their perspectives are going to be different as well. We had a very nice example from the EMA of the different models for engagement. So I think looking at how many people are involved and how diverse they are, looking at how deep a trial is, so that looking at informing it and consulting for joint decision making, and the texture of engagement, so the degree of trust and the attitude and the emotional content, and value driven participation in the engagement. Looking at the who we're engaging, a fantastic presentation again from Jessica's slide of those concentric circles. So thinking, you know, who our potential participants are, their families, and then working out the communities that they place themselves in, the trialists, frontline community health workers, looking then to who's influential, so community leaders, chiefs, as Robert pointed out, how we engage both at a grassroots level, but at the local, regional, national level, and then we start to think about cross-country trials as well. So where do we have to engage ministries of health, etc. Thinking about those people who are the invisible glue for our collaborations. So who are those who are doing the linking us to other people that we need to be talking to. So whether that's government agencies, whether that's local authorities, and not just health authorities, but, you know, who are the people who are crunching the data and doing the statistics, and then kind of looking out to all of those, and then thinking more broadly about the how we make all these collaborations work. So from the presentation from CEPI, there was that governance framework that we consider. So who are the critical stakeholders in the task force around governing your trials and your collaborations? Then thinking about the iterative networks, so those iterative feedback networks, again, very good example, and we had the fishbowl looking at EBOVAC. So how do we ensure that feedback has a 360-degree return to where it needs to go? The importance of engaging with cultural institutions. Then again, in how we run our collaborations, the important piece around how we find alignment between our objectives. I think this is a really critical piece of everyone comes to this with different expertise and different lenses through which they'll see both their motivations for the trials and their priorities for the trials. And I think that came up in the chat as well. So understanding the different expertise we have, the different priorities have, and I think importantly that you can find alignment in what those objectives are, but making the time to both ask those questions and to listen to what comes back, being mindful of different perspectives and priorities. So that critical listening piece, and how you address those tensions. Critically working up relationships and building up networks ahead of time, so that we're able to, again, work into those communities. So where you have your MSFs, your World Visions, who have great community links, know the communities well and have links to the grassroots, where are we tapping into those communities? And remembering that that collaboration is not just for research. I think, again, the point that Jessica raised. So these collaborations are important for research, but what is the longer term objective of our research? Is that to roll out medicines and vaccines? So where do you need to build in those collaborations for advocacy, for example, for funding? Or if we think about COVID, for example, so where do we ensure that there's advocacy for resources, for capacity strengthening as these workshops are around, for other elements which might feed into the overall objective. So in short, I think top tips, again, this is just from what I've heard from today: be patient, ensure that you consult, don't rush, don't compromise your actions to ensure that you undermine any trust that you've already built. Be aware and appreciate the perspectives and expertise of others that you're working with. You'll all come with your different lenses and potentially different priorities. Thirdly, consider the stakeholders who are critical. So those intermediaries, the invisible glue, and that concentric circle. So thinking of the pebble in the water analogy, who are those different groups and that you need to reach out to? So what happens in one place will have a knock-on impact in others as well. So think about that. Find the alignment of the overall objectives, even though your individual priorities might differ. Be ready to be flexible and adapt according to feedback, so constantly be in listening mode. Collaboration is a continuative and iterative process. It's important to develop these deep relationships as we go. Avoid disease or research silos, so really thinking horizontally and holistically in terms of collaboration, not just for your immediate one, but going forward. And going back to that point of deep listening, which I know you're going to cover in your next workshop, and applying those listenings to both the research and engagement with your other collaborators, your stakeholders, and your communities. And I'll leave the rest of the time open for any questions and comments. Thanks, Robin.